Chapter 3, The Blue Man Doctors. We need to talk to someone, both of us agree. We've admitted that this behavior is frightening, but both agree that we are not at the point of needing rehab. That plunge would mean we are really far gone. So instead, we visit a psychologist, which is a small slice of sanity more than anyone else in our group is efforting. Charisse is the most loving psychologist I've ever met. Jen and I squirm on her brown couch, which matches my khakis. Charisse clearly identifies that we are in a vortex of substance repetition that will not end well. Immediately, she has figured out that while Jen likes to party, she mostly ties the drug use to the female friends that she has bonded with. Charisse decides that I'm in a far different place. She comes to this conclusion mostly because when asked, I can't remember the names of most of my coveted partying friends. And I'm kind of the problem. My anxiety is driving this fatal ship, she tells us. Paul, do you believe prescription anxiety medicine may help you? Charisse suggests. I don't know. That road brings so many side effects. Well, the things you describe to me tell me that you could have a condition we call bipolar type 2. Keep an open mind about bipolar medicine, okay? After our second session, Charisse politely shares that her son has just become the latest member of the actual Blue Man group. Really? I jump. Electricity shoots up my spine. Here in 1999, Blue Man group is the big time. Everybody wants to get in to see their shows. Charisse's son has reached the top in the entertainment world. For the rest of our remaining treatments, when she talks, all I hear is the Blue Man group playing bizarre music on their PVC piping. Honk, beat, honk, honk. Charisse holds my hand. I want to help you put down this heavy bag of bricks, Paul. I get the blue part. What I can't figure out is how they keep their faces so shiny for that whole 2-hour performance. A familiar Paul blows out of Jen's mouth, scolding me to stay focused. After every Charisse appointment, Jen and I go enjoy dinner with a bottle of wine or two to discuss why we simply can't get off the partying. We don't arrive at a solution with Charisse, but I'm always hammering pretty hard that we need a geographical fix. The genius screenplay that I won't even let my wife read will sell much faster if I'm in LA. We're ripe for success. I also just won the award for Best Music Radio Personality in St. Louis, which is a plus. We could make it in LA. I promise we will make new relationships out there, non-drug relationships in Hollywood. It will be different. No more defeated mornings and wasted days. It'll be beaches, celebrities, and stardom. Let's do it while we're young. This coverall move to the left coast will fix many things. Hopefully it'll cause me to drop my endless, disgusting quest for artificial internal warmth. Chemical warmth. My history with substances was born after surgery a few years ago. I had my first painkiller at age 23 when my wisdom teeth were removed. My life truly changed that day. Like a backdraft, all pressure was swallowed up. No anxiety. Life was instantly lighter and more beautiful. Nothing provides freedom from heavy-headed obsession like pain medication. I've had many more warm narcotic moments since that dental eruption. Getting this doctor-approved feeling has been somewhat easy since developing multiple bouts of kidney stone since 1997. Just say those two words, kidney and stone, and faces wince. It's true that extreme pain swallows you whole during the time the stone is passing to the bladder, but not so much from the bladder to the toilet as everyone thinks. Pills have been prescribed somewhat freely since that first stone, and I've fibbed to doctors about them during the stoneless periods. But there haven't been many of those. So far, I've naturally passed around 25 of those little jagged bastards. Thanks, doctor. Now I'll finally be able to sleep and relax and be on the radio and dream about where I should be. Thoughts of ending up like the comedian Chris Farley occasionally dance in my mind. Every time I saw the comedian on Saturday Night Live, I felt like he was a friend. After seeing his movies, America fell in love with Chris Farley too. He seemed so jolly and funny. I was shocked to hear when personal demons caused his premature death in 1997. It also surprised me that seeing the picture of Chris Farley dead on the floor after 5 days of binge drinking and drugging didn't trigger repulsion in me. The 3 times too big tongue hanging out of his mouth was oddly fascinating. I tried not to, but I couldn't help going back and viewing it over and over again that morning. Yeah, I must be crazy. That very afternoon, I went to a doctor about another stone to get painkillers. I can't explain it, but that was the reaction. You would think that Farley's ungraceful demise would have sobered me and helped me stay away from the possibility of ending up the same way. Instead, I went in the opposite direction. Deep down somewhere, I must have twisted into a connection with Farley. In those more lonely moments, I wonder how being the type of guy who always kept a close eye on university hazing and unapproved bonfires as the president of my college fraternity got to this level of deception after college. I have no answer. Something in my head can't be right, though. Even before my wisdom teeth surgery, I was starting to feel remorse and guilt for no reason. Originally, I told myself this must be how adults think. But then I realized it can't be normal. Too many people I know seem calm and happy. I must get some assistance with this secret. So I set out to talk to an actual doctor with a medical degree in something like this. My intricate doctor screening process entails making a new patient appointment with Dr. Stanley because his psychiatry office is in the same building as my dentist. Psychiatrists can prescribe meds, and that sounds right up my alley all of a sudden. Walgreens is set to go on redial, baby. I sprint to the building from the parking lot, past a noisy ice cream truck parked in front. That's interesting, but no time to shop. This psychiatrist is on the 14th floor, and my dentist is on the 4th floor. Clearly, I have misjudged the amount of time it takes to go that additional 10 floors in a crowded elevator. I should have given myself extra time on top of what I do for a visit to the dentist. But I arrive at the bell, 10 a.m. The receptionist hands me a clipboard with some things to fill out. As I unwedge the pen from the metal clip, I realize she has given me a questionnaire as thick as Cosmo. The pen reads, Zyprexa, more effective than lithium. Lithium? I know that word. Fear moving in. Is this really a good idea? As I confess and reveal my deepest thoughts, I watch one of Dr. Stanley's clients politely squirrel past me in our silent waiting room. This guy looks defeated and maybe even physically beaten. I wonder if that's just how you feel when you finally complete this cognitive questionnaire. I could be here for hours with this thing. I was told to be 15 minutes early for this process. I see that it's 10:05 as I neurotically rip through the forms. Okay, Mr. Cook, please follow me. We go down a long mahogany hallway, settling at the office on the right. He has an awesome big window view of Highway 40. Hi there, Paul. A figure behind the big desk quietly says. I gulp audibly when I realize Dr. Stanley is actually the meek client I saw squirrel by earlier in the waiting room. Excuse me, I have a sweet tooth. Looking closer, I see Dr. Trenton Stanley is inexplicably licking an orange creamsicle from that wacky ice cream truck downstairs. That's where he went. So I launch into what I've been experiencing with the guilty feelings and down moods, anxiety, blah, blah, blah. Then I stop and wait for his expert diagnosis. Dr. Stanley says, I want you to try this medication called Effexor. It should help with those depression symptoms you're having. A loud prescription ripping sound follows. Okay, thanks. He holds it out for me to come and get it. Let me know how it feels. Sometimes it's trial and error. Maureen will set you up for another appointment in about 3 weeks. I say, He cuts me off. Thank you. And I'm out in the elevator, bewildered before I know it. 5 minutes tops. What the? Evidently, psychiatrists are a much different type of people than our loving therapist, Charisse. I go back to see Dr. Stanley a few more times. His consistently guarded 10 minutes has me on my 4th different feel-good after a few months. His version of prescription relief creates fatigue, anxiety, the shakes, gruesome nightmares that prevent sleep, hunger pangs, loss of appetite, sexual dysfunction, and a really unstable, dangerous buzz when taken with alcohol or other designer substances. I've decided to stop the trial and error he talked about. It feels like a big swing and miss. I just can't afford to have those other side effects right now. And I can't get my head off of that creamsicle.